Hello, the following information is in regards to Lucy Gray, who was admitted after reporting a dizzy spell, which resulted in a fall in her own home. Lucy's strengths include a good attitude in regards to her life thus far, and Lucy continues to be alert and oriented. Lucy wants to remain healthy and active, but is simply struggling, suggesting she needs additional services to remain both happy and healthy. My concerns for Lucy include overwhelming grief or depression and anxiety since loss of her partner and decreased social interaction with others, continued falls due to dizzy spells with unknown cause, pain and weakness specifically in her knees, and use of Celocibrix, 200 milligrams daily, which can have harmful side effects. My causes for concern are continued falls, Lucy's safety is at risk, and increase her potential for future more serious injuries. Continued excessive grief can lead to a major depressive disorder or anxiety and should be addressed as soon as possible to implement coping mechanisms and fight off anxiety and depression in the most effective ways. We must also address the possibility of it not being safe for Lucy to stay home alone anymore with a limited support system which can only come and see her on occasion. We should compare options about moving in with a friend or loved one or into a facility to keep Lucy safe, but also fulfill her social needs as well. Additional information needed is an assessment for anxiety and depression, an assessment of Lucy's ability to safely live at home alone, lab values such as a complete blood count, which could indicate bleeding as a result of the Celocibrix usage, recommend a CT scan to check for bleeding in the brain as a result of the Celocibrix usage, or from continued fall history. The most urgent problem to address for Lucy would be her dizzy spells and what is causing them. The dizzy spells may be a result of multiple sources such as bleeding caused by the Celocibrix use, underlying cardiac issues, or possibly severe anxiety. These issues must be addressed first because they put Lucy at risk for injury due to continued falls, and additional falls may result in more serious injuries and life-altering problems. As this is a continued pattern of problems, the likelihood of future falls is high. Next, address Lucy's psychosocial needs, including her anxiety and depression risk. Lucy has a small support system that may not be meeting her needs, so referring her to an outpatient or long-term care facility through patient support systems may be able to not only provide a safer environment for Lucy, but also meet more of her social needs for interaction with others. As Lucy's nurse, I would first communicate with the doctor my thoughts about Lucy needing a cardiac workup, as well as tests that can check for bleeding complications related to the use of the Celocibrix, which is causing bleeding side effects, such as complete blood count to check for falling hemoglobin levels, and maybe a CT scan due to her multiple falls in the recent time period. Next, I would have physical therapy work with Lucy and help her learn some strengthening techniques to keep her knees in good shape for the future, as well as to evaluate her overall gait in regards to recent falls she has taken. I would also have occupational therapy evaluate her and determine if she is still able to perform her activities of daily living and if they believe it is safe for her to care for herself at home alone or not. Finally, before discharge, I would discuss with Lucy and the continuing care team about options regarding different types of long-term care placements, possibly placement in a senior community to help her with her support team, but also with her social life and helping her deal with her anxiety and depression since the loss of her partner. Lucy may also require traditional type care, which provides a little more support in regards to taking care of oneself, depending on PT and OT evaluations. I would finally recommend Lucy start seeing a therapist in regards to grief counseling and anxiety and depression treatment. Having a starting point when she leaves the hospital about growing a support system in regards to her mental health will be vitally important in establishing long-term goals for life after loss. I would first try to address Lucy's concerns regarding her dizzy spells by advocating for different tests. I believe she should receive tests such as a complete blood count, CT scan, or even a colonoscopy if bleeding is suspected outside the brain. Next, while waiting for those assessments to be completed, I would implement my solutions regarding Lucy's safety at home. The first step here would be the PT-OT evaluations to determine if it is safe for her to return home alone. Her safety and avoidance of more falls in the future is key to her care. The results of these evaluations would help me come to a decision about my recommendations for Lucy after discharge, such as returning home alone, returning home with medical support, or possibly entering a senior care community or other type of care home. Finally, after addressing the highest priority needs, I would address her psychosocial needs, such as the need to see a doctor or support group after leaving the hospital to increase socialization, but also work on her issues with grief, anxiety, and depression, be it through therapy, medication, or other coping mechanisms she can decide upon. Thanks.